Hi, this is Dr. Christina Hammer coming from Vibrancy VIP Med Clinic, talking today about andropause, or what I like to say, menopause. So, what is andropause, or like I like to say, menopause? What it is when we start to age, we lose those androgens that create testosterone in our body. I'm talking to those male folks out there. When we age, we have both the hormones of testosterone and estrogen. It's just the quantities in males and females that is different. In males, the testosterone is a lot higher than their estrogen. We don't want that conversion. But as we age, as early as even 25, but on average around age 30, we start depleting our testosterone. That's why I like to say to my male patients, you start having muscle aches, joint pain, feeling fatigue, maybe a lack of endurance at the gym, saying, hey, I used to be able to run 1 mile, now I'm barely able to run a half a mile. Another thing, maybe you're hitting a plateau around 2 or 3 o'clock in the afternoon saying, ooh, I need a nap. Or maybe you're feeling fuzzy in the head, unable to focus, maybe mental fog, brain fog. Another thing is the joint pains, feeling achy in our muscles as well as in our joints. Possibility that waking, especially around that midsection. Another thing that I tell my patients is low libido, even erectile dysfunction, where, hey, I should be having a morning erection, but it's not happening for me. So a lot of people will say, well, how do I know if I have andropause or menopause? Well, I tell patients, one, you come and make a consult with me. The reason being is I like to sit down and actually listen to my patients as well as any signs or symptoms that they may be experiencing. The second thing we like to do is blood work. Why is blood work important? Well, I like to check any factor, whether it's vitamins, nutrients, our kidney liver functions, as well as our general hormones. Why? As well as that thyroid. Because any one of those things can be off and cause those symptoms. It's very important that we take a look at those levels to see if that's what's causing those symptoms for you. Another thing that I like to tell my patients is the lab ranges for each lab is going to differ. You can look at Google, it'll tell you that each lab reference ranges for people are different. Now, what I like to do is optimize it for my patients. What does that mean? So even if a normal range says maybe 9 to 25, that is not a healthy range for a male. I tell my patients I like to get you to the 900 to 1100 range. Why? Because you're gonna feel optimized. You're gonna be able to sleep better at night. You're going to be able to have that endurance at the gym, being able to lift that extra weight that maybe you were able to do in your 20s, but you can't anymore. Have that fine-toned abs again, lose that excess belly fat, as well as increase our health by actually lowering our sugar levels, as well as cholesterol. Another thing that I tell my patients is you're gonna have an increased libido waking up with that morning wood, as well as having that heart in the relationships in the intimacy zone. Because it's not all about sex, but it's also about that intimacy as well as closeness. One of the things that I didn't mention that is really important is the mood swings that happen with males with andropause. One of the things that I noticed is maybe they're moody. Maybe they snap at the dime of a hat. Maybe you tap them on the shoulder wrong. Maybe they lost that pep to their step that they used to do singing from the shower. Well, it's my job to kind of put that pep back into their step so that way they're singing and making love to their wives, as well as make love to their significant other. A lot of times people don't realize that having an imbalance of hormones can actually affect the way that we sleep. So a lot of my patients will tell me, I have sleep disturbances such I have problems falling asleep, staying asleep, or even waking up refreshed. It's really important because that's what's gonna recharge our cells and re-energize us for the next day. The mood swings, again, is the tension, headaches, as well as irritability. I can say that a lot of times you'll look at them and go, what is going on? I didn't say anything, I didn't do anything. And that's okay, it's because those hormones are imbalanced, but we've got a solution here at the clinic. Well, the next step, my patients say, okay, my blood work is back, my testosterone is low, what's the next thing to do? Well, like I always tell my patients, I like to have that one-on-one after we do that blood work to go over those labs to say what was ordered, why it was ordered, what does it mean, and what are we gonna do? So let's just say your testosterone is low. Well, I'm gonna talk to you about the different options that we can use to treat it efficiently as well as optimize those levels. I tell patients we have lots of different forms of treatment options, whether it becomes a topical cream, a rectal suppository, an injectable, even our BioT pellets. I tell people whichever way is the most comfortable, we're going to talk about the pros, the cons, as well as the benefits for each. So a lot of my patients say, okay, I've started the treatment. When should I expect to see results with my testosterone? Well, depending on each testosterone method and treatment option, we're going to reassess it no sooner than 6 weeks, no later than 3 months, just because we want to look at the symptoms again, as well as reassess and reevaluate those levels. So if you're feeling any of those symptoms that I mentioned in this video today, please feel free to contact me here at the clinic in the description below. And if you liked what I shared today, make sure to hit that like button, subscribe to my videos, and I'll see you next time. Bye!